Bipolar disorder is a progressive condition grounded in genetics. As a neuropsychiatric condition, bipolar disorder worsens with age, especially if left untreated. While treated instances can stabilize, it is essential to consistently engage in a disciplined process of medication and talk therapy to prevent symptom relapse. For those with undiagnosed bipolar disorder or those who choose to go untreated, symptoms will likely intensify with age. Hi, I'm Dr. Glowiak, and I'm a licensed clinical professional counselor specializing in addiction. Let's go over the question, how does bipolar disorder change as you age? Unlike many diagnosable mental health conditions, bipolar disorder symptoms are caused by genetic predisposition. Although talk therapy does help individuals acquire effective coping strategies, a combination of medication and talk therapy is necessary to curb undesired symptoms. Contemporary research has found a link between bipolar disorder and aging, in which biological aging differs from chronological aging. In other words, as individuals with bipolar disorder age, their years of life have a more significant impact than those without bipolar disorder. A 65-year-old with bipolar disorder, especially when untreated, presents biologically older than someone without the condition of the same age. This faster aging has been attributed to the deterioration of telomeres, which act as protective caps on the ends of DNA strands. Each time a cell divides, the telomere becomes shorter until it is so short that the cell can no longer replicate. Shortened telomeres are primarily found in neuropsychiatric conditions such as dementia, major depressive disorder, and schizophrenia. Ultimately, they impact mood regulation and memory, which are common issues seen in bipolar disorder. Given this disposition, one's ability to manage bipolar disorder cycles, especially without treatment, becomes increasingly difficult with age. Within the different types of bipolar disorder, these are the main mood episodes that may change with someone's age. Mania is a state in which one's mood and energy are elevated to a point in which one struggles to make coherent decisions. Individuals feel atop of the world, perhaps the extent of having superhuman abilities, and disregard the consequences of their actions. Hypomania is less severe than mania, but marked by symptoms of being unusually upbeat, agitated, euphoric, having a decreased need for sleep, racing thoughts, distractibility, heightened talkativeness, and poor decision-making. Depression is a condition that appears in episodes in bipolar disorder in which one feels lowered affect or mood. Here, an individual may feel low in self-worth and love, become detached from previously endeared persons, places, and things, lack of motivation and energy, experience suicidal ideation, etc. Rapid cycling is a condition in which one quickly cycles between manic and depressive episodes. Especially when gone untreated, individuals with advanced age experience these to an increasing extent. When considering the rates of bipolar diagnosis, it is essential to note that many cases go undiagnosed or misdiagnosed. This misdiagnosis is especially true of individuals of advanced age. In children and adolescents, given that early diagnosis leads towards earlier interventions to increase stability throughout life, diagnosing bipolar disorder in children affords the best opportunities to minimize symptom severity as one ages. In adulthood, though, the onset of bipolar disorder often begins in late adolescence into early adulthood. It is not uncommon for the condition to start in one's 50s or later, referred to as late onset bipolar disorder. Age of onset can have a significant impact on the nature and course of bipolar illness. With those who experience late onset, it is essential to consider other natural complications simultaneously occurring with advanced age. Accordingly, late onset bipolar disorder may be misdiagnosed for other conditions associated with aging, such as dementia, Alzheimer's, and depression, and otherwise. In older adults, unfortunately, the changes in frequency and severity of symptoms in older age groups with bipolar disorder trend toward more severe than in younger groups. A significant disadvantage of those with late onset diagnoses is that they did not receive treatment earlier in life. They may lack adequate coping skills and medication management to stabilize the condition. Further, in combination with other health issues associated with advanced aging, treatment becomes more complicated. Some changes in bipolar symptoms for older adults include more frequent episodes, more depressive episodes, and less time spent in manic or hypomanic states, less severe manic symptoms and fewer psychotic features with mania, feelings of hopelessness or despair, alternating with feelings of extreme happiness and excitement, changes in energy level, sleeping much more and much less than usual, changes in appetite, making major changes, plans or commitments but not following through with them, engaging in risky or impulsive behaviors such as reckless driving or overspending, frequent changes in self-image or self-esteem, neglecting self-care and activities of daily living, resistance to treatment options such as certain medications, suicidal thoughts or suicidal ideation, though the risk of completed suicide may be lower than in younger populations due to survivorship bias. Though individual experiences will vary, any one or a combination of the above complications may indicate a potential late-onset bipolar diagnosis. Bipolar disorder can worsen with age considering additional changes in physical health and brain functioning. But worsening symptoms don't happen for everyone. Improper treatment can manage degrading conditions. It is essential to speak up and seek support when you notice changes to your well-being, regardless of how subtle they are. Help is readily available but requires ongoing effort and attention to the problem.